3D sonohysterography for the uterine evaluation. I have nothing to disclose. The talk is divided into 4 parts, focusing on the most important elements: how to perform a 3D sonohysterography for the study of uterine pathology, what is the benefits of infertile patient. We will also show correlation between hysterosonography and hysteroscopy. I will talk briefly about the virtual hysteroscopy, and finish this speech. I will conclude with a summary. What is hysterosonography? Saline infusion sonohysterography, SIS, sonohysterography, or hysterosonography is the evaluation of the endometrial cavity using the transcervical injection of sterile fluid. The primary goal of sonohysterography is to visualize the endometrial cavity in more detail than is possible with a standard transvaginal ultrasound. The accuracy of SIS approaches hysteroscopy in detecting endometrial abnormalities. As you can see here, after administration of saline solution, the diagnosis becomes clear. As I mentioned, the saline solution distends the endometrial cavity, generating an acoustic shadow that allows perfect visualization of the inside part of the uterus. It is an easy, inexpensive, and well-tolerated technique for the patient. One of the biggest benefits of 3D ultrasound is the generation of a coronal plane which can be visualized with conventional 2D ultrasound. As you've seen in previous talk this morning, the coronal plane is essential for the diagnosis of uterine malformation and extremely useful for the diagnosis and precise localization of endometrial pathology. Another added value is the possibility of working offline with the image obtained during ultrasound. Already in 2016, our group presented the following retrospective study in which the sensitivity of hysterosonography was evaluated. We compared 109 patients undergoing hysteroscopies and who underwent a previous hysterosonography. The results show that the correlation was very high. Let's look at the indication for performing a sonohysterography. Of course, infertility and recurrent pregnancy loss to rule out uterine adhesions and other intrauterine pathology. 3D sonohysterography is important for diagnosis of congenital uterine anomalies to obtain a better definition of the malformation prior to surgical correction. Of course, the coronal plane is fundamental. In this image, we can see a partial septate uterus and this an hemiuterus. In regards to normal uterine bleeding, SIS allows the different diagnosis between the etiologies that can cause abnormal bleeding, both in premenopausal and postmenopausal patients. For example, polypoids, carcinoma or endometrial hyperplasia, and tamoxifen-induced change. In these two images, it's possible to see a hyperplastic polyp in 2 patients that are treated with tamoxifen. Also, it's important 3D sonohysterography for the evaluation of ismothele. How this article shows, using 3D sonohysterography, we obtain a better definition of the morphology of a uterine scar defect. What are the contraindications for this test? Pregnancy, pelvic infection or unexplained pelvic tenderness that could be due to pelvic inflammatory disease are absolute contraindication for the test. Active bleeding is not a contraindication, but may make the interpretation more challenging. Hydrosalping is not a contraindication, but does require the use of antibiotics. And suspect endometrial cancer is not a contraindication for the technique. Regarding medical history, if necessary, assess pelvic organ tenderness during the preliminary transvaginal sonogram. If history or physical examination suggests active pelvic inflammatory disease, defer SIS until an appropriate course of treatment has been completed. Inquire regarding latex allergy or reaction to povidone iodine. Reschedule if unusual pain, lesions, purinal, vaginal, or cervical discharge. A pregnancy test is needed only if there is a specific indication. In the same way, cervical culture are only necessary in the presence of the risk factors. In our center, we routinely recommend non-steroidal anti-inflammatory drugs like ibuprofen, 6 milligrams, 1 doses. Also, we ask the patient to come with a half-full bladder. The best time to perform the test will be in the early follicular phase, end of menstruation and before day 10, if patient is in amenorrhea or taking birth control pills at any time. With regards to the use of antibiotic prophylaxis, there is a general consensus that they are necessary only if the patient has had previous PID or if he has an hydrosalpingo at the time of the exam. This is common in IUM, ACOG, SEGO, and UpToDate. However, SEGO adds infertile patients as candidates to the use of antibiotics, and UpToDate adds the presence of other risk factors. In our center, we also use antibiotics in patients with endometriosis. In case of requiring treatment, the possibilities are azithromycin, 1 gram single doses, or doxycycline, 100 milligrams each 12 hours, 5 days. This is the main option if we see an hydrosalpingo patient. How to perform a 3D sonohysterography for the study of the uterine pathology. First, we must make a pre-SIS ultrasound, identify pertinent pelvic anatomy, visualize adnexal on ovarian abnormalities, perform an enhanced assessment of myometrium and endometrium, and visualize orientation and flexion of the uterus, helpful for placement the catheter. Flush the catheter with sterile fluid prior to insertion to avoid introducing air. Clean the external os and catheterize the cervical canal and or uterine cavity using aseptic technique. Slowly still normal saline or other constrict fluid instilled by means of manual injection under real-time sonographic imaging. Imaging should include real-time scanning of the endometrium and cervical canal. In this image, we can see the material we use: saline solution, soft and rigid catheter, and speculum. 3D sonohysterography. Now we see an example of 3D sonohysterography. First, from a sagittal section, we observe the placement of the catheter. We start instillation of saline solution and observe how uterus is distended. Here we obtain a 3D volume, being possible to move between coronal, sagittal, and axial planes. In this case, for example, we observe a polyp located in the posterior wall of the uterine. Benefits of 3D sonohysterography. The 3D hysterosonography presents a series of improvements with respect to the 2D option. It is possible to assess the uterine cavity and external contour at the same time. We need less time for the relation of the SIS. Once the volume is obtained, it is possible to work offline. Needs shorter period of distension for the uterus, which decrease the patient discomfort. And in this 2017 Cochrane review concludes that sensitivity and specificity of 3D sonohysterography is higher than conventional sonohysterography. Now I will show you several cases where we compare 3D hysterosonography image with hysteroscopy image. This is a patient who had a miscarriage and a D&C. In the left image, we observe an interruption of the uterine cavity. And as we see in the hysteroscopic image, it corresponds to an intrauterine adhesion. This one is the same patient. When the isthmic adhesion was resected, we observe a fundus, retained products of conception, and more adhesions. If you hear how the twig of the coronal plane clearly mirrors the hysteroscopic picture, you can see here the polyps that we see in the TUI image. In this other clinical case, we identify a cervical isthmic adhesion that can also be seen in coronal plane and was confirmed by hysteroscopy. Here we see the coronal plane, the adhesion, and the hysteroscopy. You see here how TUI showing irregular endometrium. And finally, if we making a rendering image, we more clearly see multiple endometrial micropolyp as seen in the hysteroscopy. The pathology reported was chronic endometritis. I want to show this other patient to illustrate the importance of rendering. Here, with a multiplanar reconstruction, cavity seemed almost normal. But when we did the rendering, we see that were micropolyps which were confirmed by hysteroscopy. This shows how 3D ultrasound and specifically 3D sonohysterography help us improve our pregnancy rates. It was a chronic endometritis too. In regard chronic endometritis, we will show this review and talk about if it's necessary to screen the patient for chronic endometritis before assisted reproductive technology. The conclusion was that given the high incidence of chronic endometritis in patients with recurrent pregnancy loss and IVF failure, it seemed logical to think about screening and treatment. Treatment is ineffective and inexpensive. However, there is some controversy because of the lack of large randomized controlled studies with enough evidence of their recommendation. What I have shown you with the two previous 3D sonohysterography is an accurate diagnosis procedure for chronic endometritis. This is an example of a complete uterine septum where 3D sonohysterography helped us in the presurgical evaluation. We see the hysteroscopy of the septic uterus and the results after surgery. This is another example of endometrial polyps and how the coronal plane helps us to locate their position in the uterus. In last image, we can see the importance of coronal plane for the localization and classification of an isthmic fibroid. You can see here how render improves the diagnosis accuracy. On the right side, you can see the corresponding hysteroscopy. And I'm going to talk about new techniques named virtual hysteroscopy. In this first video, we observe how, while performing an hysterosonography, we obtain a clear image of the interior of the uterine cavity. In this case, we observe a uterine cavity with multiple endometrial polyps. Now we try to make the rendered image. And clearly visualize the micropolyps, multiple micropolyps inside the uterus, that we can see in the hysteroscopy. For virtual hysteroscopy, we begin using the same technique as we see for the 3D hysterosonography. We obtain a volume after the cavity is distended by saline. Once the volume is obtained, we reconstruct the volume and obtain the rendered image, which is very helpful to see the details of the cavity. Then we will change the direction of the render line, green line, and place in entrance of the cavity on the right. In this way, we will obtain a view similar to that observed when we entered in the cavity with hysteroscopy. As you can see here, it's possible to move inside the uterus. So you have seen how virtual hysteroscopy allows the creation of an image comparable to conventional hysteroscopy, which in many cases will help us to better plan surgery, and in some cases it will be even replace conventional diagnosis hysteroscopy. Conclusion for this talk: 3D sonohysterography is easy to perform, well tolerated, accurate, and safe. It gives accurate information about the endometrium and the uterus. 3D sonohysterography can be used as the first level test in infertile patients for uterine cavity evaluation. Technological develops in 3D and 4D ultrasound are allowing refinement of the technique and better visualization with improved diagnosis accuracy. Thank you for your attention.